Hello everyone, this is Doug Nelson with Precision Neuromuscular Therapy. And the topic I wanted to talk to you today about is the topic of decision points. I think I certainly didn't realize a few years ago how many defining moments there are in any massage therapy session where it could have gone in a multitude of different directions, but each one of those directions is a choice. So this really goes back to something that years ago a friend of mine helped me understand, this thing by design or by default. And that's kind of one of our essences of precision neuromuscular therapy, is therapy by design, not by default. And what do I mean by default modes? For instance, sometimes if I'm in a group of massage therapists, I will overhear a conversation of, well, do you start with a client face down or face up? When you think about it, think of what that's really saying is, for everybody who comes in, I'm going to do it this way. That's not by design, that's actually rather a default mode. Because, for instance, for some clients, lying face down is really not all that comfortable for them. Or it could be lying face up, being on their back is difficult for their back, or lying face down. Or in any position, instead of doing it as the client prefers, we do it oftentimes as we tend to do it most often, not really questioning why is it that we do what we do. That's a decision point where you start with them. But it actually goes way further back than that, from what did you choose to wear that day? When you greeted the client, what was the first thing that came out of your mouth? What was the presentation that you had? If you sat down with them, what was your body language? Where did they sit? Where did you sit? Those are all choices. The questions that you asked before the session, or whether or not you asked questions, or did you run through a list of kind of a checklist of the questions that you always ask, and then kind of do what you were going to do anyway? That's really a default mode. And as one client, I remember this years ago, this man said, as I was asking him questions, he said, and get this, can we just cut to the chase and stop the charade? Like, wow, right? And the reason that he said that was, he said, other therapists have asked me these same questions. And you know what? In the end, they just kind of do whatever they were going to do anyway. So why don't you just do what you're going to do, and let's see if you can help me. That is not okay. And I understand what he's saying, and he's probably correct. But as I told him, every question I ask you has a meaning to me. And so I know this is probably a little frustrating, but it's going to slow the process down. In that, I'm going to ask you a question, and when you tell me your answer, I'm going to tell you what your answer means to me and how I will direct treatment differently because of your answer. And as you might imagine, he was less than thrilled with that whole process. And then something marvelous happened. At some point, I was doing some work with him, and there had been kind of no talking for, 8-10 minutes, and then he started laughing. And I said, "Is this funny to you? I mean, what's humorous?" And his response was, "This is the first time I can ever remember that somebody actually did what I asked." And I know in many ways he meant that as a compliment, but boy, what a kind of a sad thing that is. So I implore you, if you do assessment things, if you ask questions, think about what you're doing, and each one of those, will you respond differently for knowing that information? And the same thing is true in the medical field. If you have a test done, if you do a test, like if you do an MRI, will you treat this person differently from that information? And if the answer is no, what was the point of doing the test? It's not actually that helpful. It's not that valuable. It becomes kind of, in the science world, noise. It actually distracts from things. So the questions you ask, And then there's that point of, when they get on the table, where is the first place that you touched them, and how did you do that? And how did you decide that that is what you're going to do? Today I was treating an athlete, and I was thinking about that. If somebody was watching me from the outside and just walked in the door and saw me doing what I was doing, at any point in the session, somebody should walk in and go, boom, tell me what you're doing and tell me why you're doing it. And I should have a very clear answer to that at every moment during the session. If I can't do that, it means for that period of time, I'm sort of in default mode. And it would be a little like in this video or in a written, especially in the written word, if nothing follows that central theme, it doesn't enhance the communication, it actually confuses it. And I believe that with the human nervous system, the same thing is true. If your communication, i.e. your palpation, is very clear, and you know what you're doing, and you know why you're doing it, then the nervous system is more likely to understand what you're trying to communicate. It's a pretty simple process. Everything is a decision. Just like every word that I'm conveying to you in this video is a decision. The clearer I am with my language, the more likely you are to understand this, and then from understanding it, you can accept it, you can reject it, but at least you know what I'm trying to communicate. So if you watch me with that player, I was treating his multifidi. If you ask me, well, why are you treating that? I should be able to have a clear answer based on what this person was saying. At the same token, then there's I'm treating this muscle, but how am I treating this muscle? And why did I choose this versus that? In direction, in pressure, in frequency, in intensity. Why am I doing it? How will I know that it's better? How will I know when I'm done? All of those things are moments of decisions that I'm not sure all of us, certainly myself, did not think about years ago. And 40 years into my practice now, more than 40, really, I think about those things a lot. And I think it's very, very important. And it's my strong belief, and certainly my experience with what clients say, is that they can really tell the difference with that very clear approach versus one that's not so clear. And I think all of you, as recipients of massage, have also had that same experience, that you've been on the table when someone is kind of going through the motions, and it's nice, but it's transactional. It is in no way transformative. And I think for all of us, what we're looking for is a more transformative approach than a transactional approach. Every what that you do, technique, should have a clear why behind it. And I think that why really deepens the experience. So I wish that for you, that you apply this and think about that. The next session that you begin, think about applying that process. And I think in a lot of ways it's just questioning yourself. As you're doing what you're doing, remind yourself, what am I doing? Why am I doing it? And just the questioning alone will make you a better therapist. There's this wonderful line from a Hoffenstein poem, which is, together we learn where nettles grow. We're not the vanquished, but the living sup. For what Sir Galahad enchanted did not know, the grail is in the seeking, not the cup. I wish you joy in the seeking, and I think your clients will really feel the difference, and I think it'll be richer and deeper for you as well. So hope to see you at a Precision Neuromuscular Therapy seminar soon, and thank you for watching.